Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is about Non-Hodgkin lymphoma, NHL. What is lymphoma? Lymphoma is a malignant proliferation of lymphocytes in the immune system. This cell proliferate in the lymph node, spleen, thymus, bone marrow, and all other parts of the body. During lymphoma, lymphocytes change and grow out of control. White blood cell tumors are divided into lymphoid tumor, myeloid tumor, and histiocyte tumor. Today's topic is exclusively interested in lymphoid tumor. What are myeloid cells? Like granulocyte, macrophage, or dendritic cells. Patrol where infection might arise. Act quickly to kill aggressor. Alert lymphocyte of danger. Lymphoid cells, in the other hand, like B cells, T cells, or natural killer cells, they act more slowly and kill specifically. The third category is histiocyte cells belong to a reticuloendothelial system. The old classification of lymphoma is based on REAL, which is a revised European American lymphoid tumor classification. The newest, the current classification, is based on World Health Tumor Classification. And this classification gives lymphoid tumor as non-Hodgkin lymphoma, Hodgkin lymphoma, lymphocytic leukemia, and plasma cell dyscrasias. How to make the difference between lymphoma and leukemia? Lymphoma are solid, coercive, classically originate from lymphoid tissue. However, in HIV, lymphoma develop in central nervous system. Leukemia are malignancy of hematopoietic precursor cells, which spill into circulation system. Leukemic cells start from bone marrow. They do not stick to each other like in lymphoma. Currently, this concept has changed. During lymphoma, there are many mutations. Sometimes this mutation causes the loss of cell cohesion, which become fluid and poured into circulation. When we observe a slide, there is 4 cases of figures. The first one is lymphocyte depleted, LD. Not a lot of lymphocyte. Lymphocyte predominant, LP. A lot of lymphocyte. Mixed cellularity, MC. In between. Nodular sclerosis, NS. Nodule with collagen around Sternberg cells. Criteria of prognostic: less proliferative, that means good prognostic, when cells are cleaved, small, mature, with follicle. Bad prognostic is when it's more proliferative, not cleaved, large, immature, and diffused. It's the opposite. 3 categories of non-Hodgkin lymphoma: low grade, intermediate, and high grade. Low grade, small lymphocytic lymphoma, mycosic fungoid, follicular lymphoma, and extranodule lymphoma. Intermediate, 2 categories: diffuse lymphoma, follicular lymphoma large cells. High grade, the LASSI, L-A-S-S-I. L stand for lymphoblastic lymphoma, A stand for adult T-cell lymphoma, S stand for Sézary syndrome, and S stand for small non-cleaved lymphoma, and I for immunoblast syndrome. 3 classes to know: low grade, intermediate, and high grade. Low grade, small lymphocytic lymphoma, mycosic fungoid, follicular lymphoma, and extranodule lymphoma, which is known as MALT. Intermediate, diffuse lymphoma and follicular lymphoma, large cells. High grade, think of LASSI, L-A-S-S-I. L stand for lymphoblastic lymphoma, A for adult T cells lymphoma, S for Sézary syndrome, and S for small non-cleaved lymphoma, and I for immunoblast syndrome. Thank you for watching this episode of Medicine in 3 Minutes. Would you like to click the like button and subscribe? Your suggestions are very welcome. Thank you.